You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. It is the end of dentures today. And with us we have Dr. Alex Aalam. Dr. Aalam, welcome to the program.
Thank you so much. Thank you, Randy. It's a pleasure to be here.
Now, I have a bunch of questions I have for you, and I know you have a stack of photos. Probably
Absolutely.
We can't get to all of them. We should mention also, everything we're going to talk about today, you pretty much teach at USC, implant dentistry.
Yes,
You're a professor there.
I'm a professor. I've been involved in the grad program at USC for the last 20 years. And of course, being KOL for multiple implant companies, teaching other dentists.
KOL is what?
Key opinion leader.
Okay.
For multiple implant companies, teaching dentists how to place implants, restore implants, do periodontal surgery, gum grafting, anything has to do with the surgery of the mouth.
Now, the way you're doing it at your center, correct me if I'm wrong, in as little as 3 visits, somebody can get a brand new set of upper and lower teeth that don't come out.
Absolutely. That's something that we do every day.
Is that right? Now, you're a periodontist. You work as a team with your wife,
Absolutely.
who I've had on the show.
Yes.
Talk about it too. You also save teeth, so you just don't do one thing. Is that correct?
That's correct. So we are by base training periodontists, meaning that we are here to save teeth. But of course, at times when the infection is so advanced in the mouth, where gum disease or the decay is so advanced, we can't save the teeth. Then we have to replace the infected dentition or the missing dentition with dental implants. And there's nobody better than a periodontist or a specialist of the surgical of the mouth to be able to do that for you.
Okay, good. And I said at the top of the show, no more dentures. Do you believe that? I mean, is that the future of dentistry?
That's not the future of dentistry. Patients getting dental implants and leaving the office with immediate dentition within hours is something that we've been doing for the last decade. So this is not new. This is actually something that is established and well known by the profession today.
Okay. So who's the typical dental implant patient that you see?
So we have 2 categories of patients that come and visit us in the practice. We have the first type of patient that are patients who are suffering from periodontal disease, gum infection, dental decay, and their general dentist told them that, you know what, we need to remove your teeth and you need to get dentures. And those patients do not want dentures. They want to have a fixed dentition. They don't want to be having any removable appliance in their mouth. They want to be able to enjoy the food, and they don't want to have to think about removing things and putting things up in their mouth and enjoying their lives. This is the first type of patients that we see on a routine basis.
So people that have been told your only option is the denture.
Exactly. These are the patients who are desperate and they don't want to give in to something removable that will impair them and make them, give them a harder lifestyle. Exactly. So for the second type of patients, these are the patients that already have dentures. They have already lost their teeth and they are suffering these dentures or the partials they're having. And they just want to rekindle life. They want to go back and eat food. They want to taste their soup. They want to be able to bite on an apple. They want to be able to taste and feel the temperature of their food they're putting inside their mouth. And for those patients, we're able in one day to be able to place implants and give them upper and lower set of teeth almost instantly.
Now, is this true? You say for the denture wear that on the day of the procedure, they could walk in with no teeth and walk out with upper and lower teeth that don't come out.
Absolutely.
Is that true? Has that ever happened?
That happens every day. That's what we do in our practice. Of course, in all transparency, there are some setups. We have to analyze the patients, do some diagnostics, take some impressions. We have to prepare for the surgery. The day of the surgery, they are leaving within 24 hours of the procedure with a full set of teeth, upper and lower arches, bolted onto implants.
You're in Brentwood. I think of healthy people there. Actually, California in general, healthy people. Are there a lot of people wearing dentures?
You know, it's a very interesting topic that you bring up. I was just reviewing actually an article that was published by the American College of Prosthodontics. And they just published an article, a survey that showed that close to 40 million Americans today are wearing dentures. And believe it or not, I'm going to give you an information that you maybe didn't know here.
Okay.
Guess how many of those patients are actually having dental implants?
How many?
Only 10% of them.
Of the 40 million?
Of the 40 million.
Okay.
So just to give you an idea, 40 million people is almost double the size of Los Angeles. So if you put double the size of people living in Los Angeles in an area, this is the amount of patients in the United States today suffering, again, numbers published by the American College of Prosthodontics, from missing all their teeth.
So there's tens of thousands of people,
millions of
in
people.
LA alone that have an upper lower denture. If it's so good, then why aren't they all doing it? Why aren't they all coming in to get new teeth supported by implants?
That's a very good question, and that's why I ask them every single time I see one of these patients, why it took you so long before coming.
Okay.
And the answers are just stunning when you hear them. One of the answers that I get frequently is the fact that patients have dentures are comfortable. They just are done with dentistry. They just are comfortable with their adhesive.
So they don't come in?
They don't come in anymore. They just go see the dentist once in a while when they need to have a denture-based reline, or there's a sharp piece of the denture that rubs on their gums, and they have it filed down and just get a hard reline and just they move on by their life. And that's all they know about dentistry anymore.
So they don't know their options?
They don't know their options.
Okay.
They don't get to talk to the dentist at times. Sometimes the assistant just sees them once in 6 months, do the reline, pick up the dentures the day after, and they move on. So there's no communications. They're not part of the active dental field anymore.
Okay.
And second aspect of why people are delaying this aspect is that they feel free. We have patients coming in, and when they come and sit in the waiting room, they look angry. And they ask me, say, what's going on here? Why are you so angry? Well, are you going to send me again to the oral surgeon? Are you going to send me to the endodontist? Are you going to send me back to the radiology center? They're fed up. They just had enough of dentistry. They're tired of spending money on their teeth. And once they get the teeth extracted and removed, they feel relieved and they feel comfortable to move on to the next chapter.
So it's a challenge to get these denture wearers in, especially.
It is, because they get comfortable. They get used to it, even though it's something that is very uncomfortable by nature, but they get used to it.
How old can you be to get this done? Like, what's your oldest patient?
My oldest patient is a 96-year-old lady that I just completed a few months ago.
Why would a 96-year-old want to do this?
Because they want to eat,
Okay,
Randy. They want to enjoy life. They want to enjoy the time they have with their families. They want to enjoy Christmas. They want to eat their steaks. They want to enjoy the corn on the cob. They want to be able to eat their salads and bite on all the nuts and some of the diets they want to have every day without thinking about their mouth and just be able to enjoy every single moment of their life.
So what did you do for this 96-year-old?
So for this 96-year-old, we had to remove all her upper teeth because they were infected. There was so much disease that we had to remove those teeth, clean up the infection. We placed 6 implants for her, and we give her a permanent set of teeth that never came out anymore. So when I talked to her that very same night, and I talked to her daughter, she was mentioning to me that she was very happy. She was able to eat that very same night a very, of course, light meal, but she was thrilled not to have to remove that little removable partial that she have, be able to go to bed with her full set of teeth and not to think about them anymore.
And they're just like regular teeth after that? Meaning you brush them, get them cleaned?
Absolutely.
At the dentist?
Exactly. They fall into the same regimen of hygiene protocols that we have for our patients.
Now at your office, I guess correct me if I'm wrong here, how dental implants are typically done is you go to one place where they do the surgery, like they go to a specialist like an oral surgeon or periodontist like you.
Absolutely.
Then they go to another dentist where they put the teeth on top.
Exactly.
You do both parts. Is that why you do it so quickly?
That's what we do, exactly. We have basically a proximity to the lab. We do the temporization. We do the restoration in our own office. Patients come in, we sedate them, do the surgery, place those implants, take the impressions, and within 24 hours they leave with teeth. That's
What's
exactly
it like
what we
when
do.
they see themselves in the mirror the first time?
They just love it, Randy. I mean, I just can tell you so many stories about happy patients that we have. And one of them that strikes me is a patient that we treated probably 10 years ago. And she was wearing denture most of her adult life. And the first thing she did after waking up from sedation, and this is a true story, she jumped out of the dental chair and she asked for an apple. She wanted to eat something hard to see if I was able to deliver what I promised her. Without, still, coming out of the anesthesia, she said, please give me something hard to eat. And we had an apple in the office. And she started eating on an apple. And when she started chewing, and she realized, oh, these are permanent teeth. They're not moving. I don't have to feel this adhesive or glue or denture moving. She just hugged me. And she's been a patient of the office since then. And we see her every 3 months for maintenance. And she hugs me and she mentioned to me how much we changed her life and how she's able now to be able to not be that person she was before and grow into a different person.
Now you teach USC.
Yes.
And implant dentistry.
Yes.
And there's a trend, because we do a lot of these programs, where people are doing the snap in, snap out
Absolutely.
teeth.
Absolutely.
You don't like those?
Of course not. Nobody likes them. The patients don't like them. They don't have an option. This is plan B, basically. Why would anybody want to have 4 implants placed, go to a surgery, get those post in place, and still be with the removable?
So it's still like a denture?
This is a denture. it is not still a denture. It is a denture.
But the new guys, do they start out that way oftentimes? With the snap in, snap out?
Because it's forgiving, Randy. It's a
what does that mean?
It's basically less technique sensitive.
It's easier?
It's easier. You may not require the same level of skills in terms of the surgical placement of those implants and the restoration. So there's a bit more forgiving aspect in patients who already have dental partials, removables, are accustomed to that. So they are more able to accept this kind of treatment. It's not such a big transition for them, and they're okay with that.
Okay, good. Now, you brought some photos
Absolutely.
of patients that have been through this procedure.
Absolutely.
And I guess every one of them,
Yes.
their option was a denture, and you gave them upper and lower teeth that don't come out.
Absolutely.
Let's take a look. Perfect.
So this lovely lady that you see in this picture that I brought here, she's a patient that traveled all the way from the Bahamas to see me. Her kids actually did the research and find us online and decided to give us an opportunity to meet her and see how we could help her. This patient didn't want to wear dentures anymore. She lost.
Is that
her
what
teeth.
she's wearing right there?
That's what she's wearing right now. She's wearing an upper set of denture and a lower set of removables, and she was just tired of them. She just wanted to have something new, something that she wouldn't have to think about, and just move on with her life. She basically traveled most of the country, the East Coast side, and visited specialists, periodontist, oral surgeon, and they all told her that she was not a candidate to get fixed implants and fixed teeth because of the lack of bone. And we had the opportunity to see her. We basically, in a few visits only, extracted the remaining of her teeth, placed implants on her upper and lower jaw, and give her a fixed permanent set of teeth that is not coming out anymore. And this woman today is just an amazing patient. She comes with her daughter to the office at each appointment.
Okay.
She just glows. She's just so happy, and her life has changed. And you
Let's
can
take a
see
look at
here,
the after.
This is the after picture. This is the same
wow.
patient. Look at the difference in her smile. Look at the difference in the happiness that you can see in her eyes here.
Yeah.
She is a different patient. She's a different patient. She's a different human being. And you can see how she rekindled with that life energy that she's lost on that picture that you can see on the before.
Yeah, but isn't it true, though, like you said, if she was in dentures for like, what, 10, 15 plus
Probably
years?
more, absolutely.
Isn't it true you don't have enough bone to do this?
Well, there is bone. There is always an option to find
But
bone
isn't
for
it
a
true? I mean, if you've been wearing a denture, like you said, she was wearing one 15 plus years.
Yes.
Isn't it true you don't have enough bone to do this?
You know, I think you're wrong on that,
Okay.
Randy, because there is always an option to get dental implants for our patients in a fixed, in a permanent way.
Okay.
There's always anatomies that we are not looking at by the limitations of some technologies or by the skills of the doctors. So we have technologies today, we have radiologists technologies today, we have surgical techniques today that help us to be able to find bone where we don't see them inside the mouth.
Have you ever turned away someone you just said, I'm sorry, you don't have enough bone to do this?
I don't remember one patient that I've turned away from the practice for not having enough bone to place dental implants as of today.
So it's technique driven.
It's a lot of technique driven, a lot of skills, a lot of trainings that goes into it to be able to find this bone that is not inside the mouth to be able to anchor those implants.
So what does she like more? Because it obviously looks good. Does she like the look or what she could eat?
Well, she came here with a chief complaint of wanting to eat better and have a better function, quote unquote. But as you can see through these pictures and look at her smile, that she starts to like herself more. She likes her appearance better. She likes her smile better. She's able to go out with her friends, enjoying her lunches and her dinners without being concerned about having a removable device in her mouth, having food going underneath that denture, being able to eat her salads and her steaks the way she wants to do it, and not be able to be concerned about any piece of plastic in her mouth anymore and enjoying the taste and the function of her food.
Now, most people over 70, according to an article I read, are on 4 medications or more.
Absolutely.
So can you be on medications and still do this?
Absolutely. So we work, of course, with your doctors to make sure that you are in good shape. We make sure that the blood work is done before the surgery, if there's any reason for you to do that, to be able to provide you the best and the safest procedures. But it's very rare that we have to turn down a patient because of some medical condition.
Even if you have a little bit of osteoporosis, you could do this?
Absolutely.
Actually, a blood thinner? Could you be on a blood thinner and do this?
You can be on a blood thinners, of course, and we can, of course, communicate with your cardiologist to see how we can create a window which you'll be off the medications. And to go back to the question that you asked about osteoporosis, dental implants are an indication for osteoporosis because the bones of the face are not subject to the same bone metabolism than the long bones. And therefore, patients who have osteoporosis do not necessarily have osteoporosis or bone deficiencies into the jaw due to their medical condition. Let me show you a wonderful story for this other patient here.
Okay.
This lady came to the practice needing her teeth to be removed, and she saw different doctors, different surgeons, that they proposed to her to have her teeth to be extracted, have grafting done, and wearing a partial and a removable for a period of 2 years before she could get dental implants.
Okay.
And of course, she didn't want to go through that. She didn't want to go to the expenses of massive bone grafting, to wearing dentures for 2 years and be uncomfortable for that time. So we had the opportunity to see her, treat her,
and she didn't want a denture.
She didn't want a denture. She didn't want to have anything removable. She was done with removable when she saw us. She was wearing a removable for most of her adult life, and she was ready to change that. And this is, as you can see here, this transformation.
Wow. Doesn't even look like the same person.
That she benefit from. Yeah, she looks actually like her daughter, as you can see here. Okay, she looks so much refreshed, younger. You can see again through the eyes the life energy that we're able to recapture here, the purpose of life that came back to her. And you can see as well how the smile is beautiful. The teeth have been designed very nicely, fitting her the lip line, making sure that the papillas are in the right position, the incisal edge in the right proportion. And we have a happy patient today that is able to eat well, go see her friends and family, go to all the social gatherings without being concerned about having a removable, what she can eat or not eat. But as well, she feels amazing and she looks amazing, as you can see here.
Now, on her before photo, that's got to be unusual.
No, Randy, this is not unusual. This is exactly what we see every day. Patients coming with failing teeth this way don't want to smile. They don't want to show their teeth. They're ashamed of their teeth. They're uncomfortable. And every time that we take their before pictures, we have to pull out that smile out of them.
They don't even want to show you their teeth?
They don't want to show anybody their teeth. They're embarrassed, Randy. They don't feel good about themselves. So it's complicated for them, but we have options today. We have alternatives today that can help them overnight, within 24 hours, to switch from no teeth, dentures, to a fixed set of teeth, permanent set of teeth that does not come out.
Now, we're going to get emails about this, but insurance, even the best dental insurance, doesn't really cover this, small portion. Medicare, Medicaid doesn't really cover it, but you say people finance this routinely.
Absolutely. People find a way to get a healthier smile. People find a way to treat themselves for the rest of their life. People want to feel better, so they do find ways to come up and pay for this treatment. Absolutely. So we do, of course, have financing services that we have in the office, and of course, dental insurance do cover a small portion of it, but most of them is at the responsibility of the patient. Absolutely. Jose is an engineer in a building where he sees people every day. And believe it or not, on these pictures, Jose has already dental implants, but he had one of those snap in and snap on. And he was uncomfortable with them. He was not able to chew with them. So sure, of course, they were more stable compared to a traditional denture that is held with adhesive, but those snap in and snap on are not exactly what he was expecting after getting dental implants. So what we did for Jose here is that, as you can see here, we removed all his failing teeth. And
looks good.
Yeah, it looks amazing. We basically placed, again, implants on his upper and lower jaw and give him a permanent set of teeth now. And Jose has changed. As you can see, he looks younger, he looks more refreshed, he looks much more sophisticated, as you can see.
Yes, okay.
And you know what is his nickname in the office right now when he comes in?
His nickname, what?
His nickname is Marlon Brando.
Marlon Brando.
We call him Marlon Brando because he comes with that posture in the office. He comes so strong in the office. He comes so happy in the office. And we just love seeing Jose coming to the office because he's so happy now.
So a patient like this, I mean, could they eat like a raw carrot? Or like chewy things, like almonds or whatever?
Absolutely. So we, of course, have to always warn them at the beginning when they're healing to take it easy. But once they get the permanent set of teeth, they can pretty much eat whatever they want.
Like anything you could eat with regular teeth?
They can go out and eat salads. They can eat cucumbers. They can eat carrots. They can eat apples. They can eat whatever a normal diet consists of.
What do they like most? The way it looks or what they could eat?
You know, it's funny. It always starts with what they can eat. People always have this need of getting rid of the denture to be able to have a better quality life, which means eating their food, tasting their food, having a tomato bisque and feeling the temperature, the heat in their mouth, which they're not able with the denture. As they are growing into their dietary habits and understanding that they're back into a normal lifestyle, their true personality comes up, their smile comes up, their social skills comes up. And at that point, they love the way they look, they love the way they feel, and they are just different people, Randy. They're just different people. Yes, so it's very emotional. Let me give you a little story of a patient that I treated just recently. This patient comes with her daughter, and we delivered the final set of teeth for her, the final porcelain. And we're just taking the final pictures to basically give it to her. And in the background, her daughter started crying. And we turned around and we asked her, why are you crying? This is a celebration today. Your mom is actually getting a wonderful start of a new life today. Why are you so, why are you tearing? She goes, this is the way I remember my mom when I was a child. And this is
That's
the
nice.
smile that she had. This is the energy, the life that she had in her eyes when I was a baby, when I could see her growing up, that she lost the day that the dentist extracted the teeth and put a set of denture in her mouth. So she was just very emotional and happy to see her mom back to where she used to be before life with dentures. This is again another wonderful patient that I want to share with you here. She's a very bubbly, a very happy patient. So this patient suffered from a very severe type of gum disease, and she was tired of going to the dentist. Cleanings after cleanings, set of deep cleanings, antibiotics, and there was no result. And she was basically given the options to get dentures, and she just didn't want to have dentures. So she found us, and we basically extracted the teeth, as we had to do them because of the severity, unfortunately, of the periodontal infection that we had, placed for her implants on the upper and lower jaw, and immediately provided her with a permanent set of teeth. And this is here, as you can see, the wonderful result that we were able to provide her. These are, again, permanent teeth that do not come out, and this was done for her within 24 hours of the procedure.
Now, but if somebody has bad gums, can they do the implant procedure?
Absolutely.
I mean, are they more likely to fall out if you have gum disease?
No, Randy. This is actually a forced conceptions for this particular type of patients. These patients are actually the best patients we want to have.
Okay.
Because once we extract the teeth, clean the gums, clean the bone away from this bacteria, this patient is disease-free at that point.
Well, that's nice.
And we're working with a clean environment, free of infection.
So it doesn't matter age or if you have bad gums, you could do this procedure.
Absolutely. They're all candidate for this. Look at this one. This is a wonderful
wow.
patient of ours here. So, Randy, this is a young patient, as you can see, that was offered to wear a denture. She was missing teeth for the longest time, and the only alternative that was offered to her was to wear a complete upper set and lower set of removables, and she didn't want that. And she came to our office, and we treated her, as you can see here, with a full set of upper and lower implants.
Oh my goodness.
That are holding a permanent set of teeth here. And you can see that from the before picture to the after picture, how it has transformed her persona, the image and the looks that she's transferring.
She's got to be happy about that.
She has her life has turned around. She's having she has a wonderful job. She's very social. She comes to see us in the office. She's just communicative. She's talking more. She's not shy anymore. It was so hard to be able to talk to her before.
So her confidence comes out because of
confidence
this.
came up. Exactly. She's changed.
And by the way, on the before photo, was it hard for her to eat with those?
It was hard for her to eat. It was hard for her to smile. She didn't want to be here. She didn't want to confront and have dentures wearing. So she was very unhappy to be there.
Do you get excited? Like, look, on the consult, you're on a consult with a person like this.
Yes.
And you know she's going to move forward with the procedure. Do you get excited? Do you say, wow, she doesn't even know how good this is going to be?
It's the best part of the consultation. It's the best part of this consultation. Every time that I talk to my patients, they ask me, like, why are you smiling so much? And I just tell them, because I can see exactly how we're going to look like and how this treatment is going to affect your life and how you're going to be so happy for the rest of your life after this procedure is done for you. So I can already see the impact of not
This is
wearing
very
dentures.
nice.
Randy, do you have time for 2 more patients?
Yes, you're going to have to go quickly. 1 minute left.
This is again another patient of ours. Look at that. This patient again suffered from a severe type of gum disease. The only options that he was offered is to wear complete dentures. As you can see here, we extracted the teeth, upper, lower, full set of implants, supported
Handsome
restorations. Exactly. Look at the transformation on his smile.
Yeah.
Look how we corrected the gummy smile. Look at his lip line. Look at the incisal display that he has now. And all this work was done by design. This was not an accident. Everything was planned from the moment we see this patient. And to go back to what you said from the previous case, we could see that. We could see exactly how this patient would look like before the procedure and project it into an outcome, and we're able to deliver that for him. This is again the last patient I'm going to be sharing with you. Look at this guy here.
Oh boy.
Unbelievable transformation here. Look at that. He was wearing removables for all his life as a teenager. Again, extracted the remaining infected teeth, loose teeth. We did implants on his upper jaw, and we just give him a new life. Look at the transformation on his smile. Look at the transformation on the way he's carrying himself, the confidence. He looks like a movie actor, right?
He does. He really does. Now, we're out of time. So, final message to the person with really bad teeth watching this. They don't know if they need a denture. They don't know if they could save their teeth or they qualify for this. And then the other patient that's the denture wearer, they're watching this. But let's say they're skeptical or they're afraid. We didn't even talk about IV sedation, things like that, because these people don't feel anything during the procedure.
Absolutely.
They're sedated. You say they have little memory of the procedure when they get it?
Exactly.
What do you say to the person that's still skeptical?
Come and talk to us. Come and visit us. Make a consultation appointment. Let us meet with you. Let us listen to your story. Let us discuss with you your options, and then make up your mind. But at least you'll have the entire area of treatment available to you, and you can make this decision, making sure that we have everything discussed with you and all the options on the table.
Dr. Aalam, thank you for coming on the show. Good stuff.
It was my pleasure. Thank you so much for having me.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.